Dave Scott, Hub Media. Today I'm joined by Barb Anstead from Dover Apothecary, and I just finished reading Barb's May story for the Hub, and I wanted to talk about it, Barb, because you brought up a lot of really good points, and I think it's imperative that we sort of bring this out to people. I know COVID's been here and it's never seeming to leave, but what you point out is we've just spent a couple of years isolating, and now we're getting outside and all these other viruses and germs are saying, hey, where you been, and attacking our bodies. So our immune system is sort of doubling down and having to fight other viruses that we kind of forgot about, that we hadn't seen in a little bit. And getting back to socializing is probably, the brunt of it. We're seeing all these folks and everybody seems to be getting a little bit ill these days. So what are you going to recommend? What should we do?
Well, it's so true. And anybody that has a young mom in their life, that their children are in school, and they just are bringing one thing after another home. And these moms are frustrated, they're exhausted, they're losing time from maybe their jobs that they're just getting back to. But the fact is we are in the thick of our regular cold and flu season. So there's going to be all sorts of stuff out and floating about. And the immune system isn't unlike our muscles. We haven't necessarily been challenging and using and maybe supporting our immune systems for several years now. And then suddenly it's like diving into this big pool of everything. So it's going to be like we've all just started kindergarten. You're very likely to continually be infected with something. So a healthy immune system has the ability to fight that off. And there are many foundational things that we need to do that way. I sort of liken it to the story of the three little pigs, which most people will be familiar with. There was a straw house. So when we think of our body as our house, because it is, and we need to be taking care of that. So you've got your straw house, you've got your wooden stick house, and then you've got your brick house. So we all know which one's going to stand up the best to the different traumas that are out there, the different exposures. So if we're not nutritionally looking after our body properly, not sleeping properly, not hydrating properly, maybe we need specific supplementation. If we're not doing any of those foundational things, then we can expect to be weakened and succumb to those things really, really quickly. So it's important that we understand how to take care of the body first, that we do understand that, yes, our exposure to things is going to be heightened right now, but to be less frightened about it and more empowered about it. But we also have a social responsibility here as we get out more. I have seen a lot of people posting that their COVID test has come back negative. So we have to be careful with that. The reason being is that you may be testing too early. And if you're testing too early, you go out into the public with this false sense of security, and you might be fine. You may be hardly even symptomatic, but we're protecting those that are more vulnerable. And that's regardless of whether it's COVID. The common colds and common flus can be devastating for people that are undergoing cancer treatment or have other health conditions. So we have to be mindful as a society that even though we know we're going to be fine, the next person might not be. So even if your COVID test is truly negative, that cold or flu can still be very devastating. You can take a gastrointestinal bug into a nursing home, and that's going to have really catastrophic consequences to the people in that nursing home. Or, so we've got to be mindful. We need to not be as frightened and more empowered in what we're doing to take care of ourselves and really look after that foundation, look after our home, understand that we have that microbiome, not just on our skin, but intestinally, where 80% of the immune system is. So good quality probiotic. Make sure you're taking vitamin D3. We've just come through basically 6 months of the year in this part of Southern Ontario and many places where we can't produce vitamin D. and that is critical for immune response. So there's things like that, and just overall nutrition. If you're fueling your body with the foods that are actually the best for your system and not all mucus forming. Okay, so sugars devastating for immune function. Things like dairy and wheat build up a lot of mucus in the system. So if you're somebody that struggles with respiratory problems, whether lower or upper, and you're eating those types of foods when you're not well, you're producing all this mucus and you're just making this great playground for all of these viruses and bacteria that you've been exposed to. We need to hydrate, okay? Do a sinus rinse, okay? If you know you've been out and you're suspicious that you've been around people that aren't well, then do a sinus rinse and reduce the bacterial or viral load that you've been exposed to. I'm a big fan of zinc lozenges. Actually have one up right here. And not brand specific, there are lots on the market, but this particular one, okay, so your lymphatic tissue, if you still happen to have your tonsils, that's your first defense when we're exposed to something. So having a zinc lozenge in your mouth when you're out in public, whether it's, on transit, if you're on an airplane, just in the grocery store, that zinc lozenge when you're out and about can have a huge difference in reducing the ability for viruses that you're exposed to replicate in your system. So there's lots of little tricks, extra vitamin C, but it's foundationally, we have to manage our stress, we have to be sleeping well. If there's anything that's, sort of not as it should be, that increases our likelihood of catching something. So it's our bodies are incredible. We just have to understand how to work with them.
I think too, right now, we've all come through this 2 years. We've all had our vaccinations, and you've worked hard to keep your immune system charged up. Then all of a sudden you're allowed to do everything, and you kind of forget about your immune system for a minute. You kind of go, well, we got through that, but this is the time to actually, what you just explained to me, my perception of it is, this is the time, folks, to really step up your immune system, because this is the opportunity to fight off other things that are coming your way, because we haven't seen them in so long. So I think that's great advice. I think that's, it makes so much sense when you explained it, and when I read your article this morning. So yeah, folks, you got to keep that immune system going hard now. This is the important time as well. Like Barb said, cold and flu season is here. You don't want to risk stepping back again. That's for sure. None of us in society do.
No, for sure. And, when we're empowered, when we're taking those steps to support our systems, even if we do come down with something, we're minimizing the effect that it has on our bodies. We're recovering quicker, because if you keep getting something over and over before your system's actually had a chance to correct itself, then your vulnerability stays heightened. And that's what we want to do. And I mean, coming through Easter, there's a lot of sugar out there, a lot of chocolate. Yeah. And even a teaspoon of sugar, you guys, 1 teaspoon reduces your immune system for 5 hours by 50%.
Wow.
So
I did not
think
know that.
about that, and then think of everything that's out there. And we can make ourselves stronger, or we can make ourselves more vulnerable just by how and what we're fueling the body with. And those are things that we have in our control. All right, so we can gargle with salt water, disinfect your toothbrush, do that frequently. There are just so many simple things. Wash your hands with soap and water. If you have to use sanitizer, that's fine, but you don't want to use it all the time, because it also eradicates the healthy microbiome that's on your skin naturally. So if you've used sanitizer, touch a contaminated surface, the next thing that you touch has complete ability to become more virulent, because you don't have anything on your skin there to fight it. So that's why the soap and water thing is a good thing. And again, those sinus rinses at the Apothecary, we go through a ton of those, because it's a great way to just rinse things out and reduce that viral load. But I also really, really urge people to keep their supplements for immune support on hand. You don't want to be already sick when you realize that
Right.
you need these things. They should be in the house. Have some broth in your cupboard, some good nutritional chicken broth or beef broth or vegetable broths, just something that you can keep your minerals and your hydration level up with if you don't feel like cooking. A probiotic is huge, especially for people that are prone to diarrhea, because we actually dehydrate really, really quickly from diarrhea, more so than we do from vomiting.
Yeah.
And
Makes
especially
sense.
seniors, they're very vulnerable to their electrolytes and minerals throwing off how their heart is functioning or how their brain is functioning. They can get a UTI, a urinary tract infection, very easily, and it can mimic dementia. So if you see somebody decline really, really quickly, then we
Yeah.
need to suspect that maybe because they haven't been drinking enough water and enough fluids, that those things are going on. So, stay in touch with your loved ones, your neighbors, be good stewards of the community. If you're not well, doesn't matter if it's not COVID, all right? You're still contagious. If you're actively sick, please try to stay out of the general public because nobody wants it. You ask any young mom right now that is losing her mind because her kids are constantly sick right now. And, we don't need to be sharing those things. We need to be getting out there. We need that fresh air. Open your windows, clean the air
Yeah.
filters on your furnaces, do things, to air out your house. Thank goodness. Well, I mean, seems like we've still got a few weather blips coming our way,
Yep.
but it's really, really important to have that fresh air and gentle exercise. You don't have to run a marathon, but you do need to get out there and stay active. But just remember, the immune system's like a muscle too. We have to use it or we lose it. And right now, that's what we're seeing is people with immune systems that haven't had those workouts. So try not to be too alarmed. Please speak to a professional to see what supplements might be best for you or what food strategies or just overall lifestyle, holistic care of yourself and your family. What will be the supportive way to go that way? And we love, if you're not feeling well, we'd prefer you call us at the apothecary
I
as
was just
opposed
going to
to
say.
coming in there, because if we get sick, we can't help you guys. And so we do appreciate that respect very much. And we work with our folks, very, very carefully to make sure they have all the tools they need.
Thanks, Barb. It's wonderful talking to you today, and great immune
Thanks.
talk. I mean, obviously, we need to be well aware, and the folks at Dover Apothecary, you and Mike and the staff there, are always here to help. Like Barb said, if you're under the weather, just give a call first. Maybe we can just do it over the phone. Thanks for doing this. You take care.
You too. Thanks, Dave.